So nosodes refined. So I'm going to talk a little bit about lesser known things about nosodes. That's my whole idea today. And the first remedy I'm going to talk to you today about is Syphilinum. And this is a very important nosodes in today's clinical practice. And I use it a lot in my practice. In my clinic, this is a remedy which I use very often. So I want to tell about very, very important things about this nosodes. So what is the main genius for me of Syphilinum? It is syphilitic taint with a lot of weakness, with very few symptoms. Whenever there are very few symptoms, but you see a little syphilitic miasm in the background, think about Syphilinum. It's not a remedy that you will prescribe when there are local indications, but more of a remedy when you look at an overview of a case. Syphilinum is very important in ophthalmic pathologies, and I'm using it a lot in very, very difficult ophthalmic pathology, especially in progressive ophthalmic pathologies like progressive atrophy of optic nerve, premature macular degeneration. Whenever there is premature illnesses in children, think about it. One of the very important keynote in ophthalmic cases is cool bathing ameliorate with a lot of photophobia. Also, very, very top remedy in neurological cases, especially in cases, one-sided cases, paralysis of one side with difficulty in speech, twitching of muscles, aphasia with paralysis. The most important keynote, slowly advancing hemiplegia. The idea is slowly advancing. It has a specific action on musculoskeletal system and on spinal pathology. One of the keynote is a lot of pain and coccyx for a long time. It's also a very important remedy for bone pains, typically. One of the things I want to tell you is syphilinum has almost no expressions on the face. There are people who have almost no expression. Again, today's presentation is held by Dr. Juhi. So if you're watching this, Juhi, thank you, and all participants should thank my friend Juhi. Syphilinum also has a deeper sepia saddle, which means the facial discoloration is more deeper and teeth are decayed at the edge of the gum. There is a long longitudinal crack along the center of the tongue. Nails often distorted, and they generally feel better after heat. It is one of the top remedies for worst kind of fissures in anus. Worst fissures, worst constipation, think about Syphilinum. Another very well-known keynote, total sleeplessness. They just don't get sleep at all. They are a wreck, can't get sleep at all. Also, ovarian pathology, think about Syphilinum. But Syphilinum, slightest touch aggravates, while Medorinum, better by pressure. So in this way, how you can differentiate Medorinum and Syphilinum? And I think in one of my seminars I had spoken about this, how to differentiate. Someone asked me how to differentiate Medorinum and Syphilinum. It's very simple if you know repertory really well, and that's what I live in. So if you just open the rubric sunset and you see sunset aggravates, you see Syphilinum, which means night aggravated Syphilinum, and sunset ameliorate, which means night ameliorate is Medorinum. Just remember this and you can differentiate Syphilinum and Medorinum. Very, very offensive leukorrhea, which is often concomitant to ovarian pain. Also, in today's time, very, very important remedy in collagen vascular disorders, Wegener's granulomatosis, where there is a deep-seated structural pathology. It also has a damp weather aggravation. Also, I've seen a case of a very interesting pancreatic cancer which improved with Syphilinum of one of a homeopath that I knew about. Also very important for osteosarcoma, Hodgkin's disease. Two important modalities you should know, night aggravation, which I told about, and better by slow motion, like pulsatilla. So interesting. Now let's try to understand the state of mind of Syphilinum. The main state of Syphilinum is despair, no hope, no reaction. It's a total despair, despair of recovery. They just feel nothing can be done now. They are totally expressionless. They have been through the circus and they are like, ab kuch nahi ho sakta. That's the kind of face. A very self-destructive trait in them. The main thing is the love of life has almost totally gone. They become very, very self-destructive. You can see very beautiful picture. This is also done by Dr. Juhi. So interesting, no? Self-destructive. So when you see someone destroying their own self, think about syphilinum. But what is interesting, self-destructive can be all of them. It could be sorinum, it could be syphilinum, it could be tuberculinum. How to differentiate? Tuberculinum breaks things. He will not try to kill himself. He will try to break things. Sorinum is a totally different ball game. In Sorinum, still there is some hope remaining. In Syphilinum, there is no hope at all. In their dreams also, they see their own death. They see their own disease. They often see that they are terminating into death. They even get dreams of burying alive, like Chelidonium and Arnica. Dreams of being buried alive. This is so beautiful, beautiful symptom of Syphilinum. Also there in Chelidonium, Arnica, and Ignatia. So interesting. Can you see this picture? This is the way patients describe. Are you understanding what I'm trying to say? Say a yes.